How long does it take to recover from hip replacement surgery? How long will I be in hospital for, and what will recovery be like once I get home? Will I be in pain after surgery, and how soon can I get back to work, driving and other regular activities? I'm Joe Pagkalos, consultant hip and knee surgeon here at the Priory Hospital in Birmingham, part of Circle Health Group, the largest private healthcare provider in the UK with over 50 hospitals across the country. Today, I will talk you through everything you need to know about hip replacement recovery, answering all the most commonly asked questions and taking you through hip surgery recovery timeline from right after your operation through to full recovery. I'll cover key information on hip replacement surgery, such as what it's like recovering in hospital, how you'll work with your physiotherapist to regain strength after surgery, how to look after yourself after hip surgery, your pain levels, and even why to go private for hip replacement surgery at Circle Health Group. Hip replacement surgery is a significant procedure that comes with a recovery period. Understanding what to expect during this time is crucial for a successful outcome. Your recovery journey is unique, influenced by factors like age, fitness, and reason for surgery. However, certain aspects of recovery remain consistent, so let's begin. After your hip replacement surgery, you'll be taken to a recovery room where you'll gradually come round from your anaesthetic. Your anaesthetist will have discussed various options of going to sleep or remaining awake during the procedure. Oxygen tubes or a mask will assist your breathing as you come round, and your nurse will be there to make sure you're comfortable. Once awake, you'll be able to sit upright in bed and you'll be able to eat and drink. It is important to be up and about soon after the operation, so our team will encourage you to get out of bed, and our physio team and nurses will be on hand to show you exactly how to move about safely. They will show you movements that you should avoid over the first few weeks to avoid overstretching the joint. You'll have a TV in your room and Wi-Fi so you can bring your own entertainment. You'll have a menu so you can choose a variety of food from, and the team around you will be on hand 24/7. It is very normal to experience discomfort for some time after surgery. Your hip, knee and groin will feel sore. Our healthcare team will be there to give you pain relief, anti-inflammatories, and to help soothe the pain and reduce the swelling. When you wake up after surgery, you'll find that the incision over your hip has been closed with surgical sutures and covered with dressing. You will want to avoid getting your dressing wet, so you'll need to take care in the shower. Some dressings are waterproof, which means that you can shower normally. Early mobility is essential for a speedy recovery. Your physiotherapist will guide you in taking your first steps using crutches or a walker, ensuring your safety and support. Your physiotherapist will create a tailored exercise plan to strengthen your hip muscles and enhance mobility. These exercises are crucial for your recovery journey. You'll be taught these exercises at hospital, perhaps at our on-site physiotherapy clinic, and we will ensure that you know how to perform them safely when you return home. These exercises will help strengthen your hip muscles and improve your mobility, reducing pain and supporting your recovery. If you happen to need any specialist equipment to do your exercises, your physiotherapist will show you how to use it and make sure that you have the right equipment at home to carry on. The average stay of total hip replacement patients is 2 to 3 days, but this can differ depending on your circumstances. For example, if you have a pre-existing health condition that means that you need to be monitored for longer than usual after surgery, you will stay in hospital for longer than this. Research shows that people recover better at home, so we won't keep you in hospital any longer than you need to be. But rest assured, every person is carefully monitored and you won't be discharged until we are completely happy that it is safe to do so. Before leaving hospital, your consultant will cover any questions and provide guidance on home recovery. Our support doesn't end here. We're here for you throughout this journey. You will need to arrange for a friend or family member to collect you from hospital, as you will not be able to drive home yourself. If you prefer, we can arrange for a taxi to collect you from hospital when it is time to go home. Remember, just because you're going home does not mean that we're not still there to support you. You can always get in touch if you need to. Recovery continues at home, where you'll gradually regain more strength and mobility. Your physiotherapy exercises will be your guide, helping you eventually return to your routine. By the time you leave hospital, you should be feeling significantly better than when you first came around after surgery. Your physiotherapist will have helped you start walking again. Your post-surgical pain will have significantly improved. Do remember though, Hip replacement surgery is a significant operation and your recovery is not over yet. You will need at least a few weeks of rest and relaxation, and you won't be able to go by your daily activities as normal for a while. Around 2 weeks post-surgery, you'll have an appointment with a nurse to get your wound checked and any stitches removed. You will meet your consultant again after 6 weeks. At this point, you'll be feeling much more comfortable and mobile. You'll be able to chat through with your consultant around getting back to driving, returning to work, and any other goals and hobbies you have. It is important to pace yourself when exercising after surgery to avoid straining your hip and affecting your recovery. Any exercise should be eased into gently and slowly. Slow-paced walking will help strengthen the muscles in your leg and allow you a gentle workout. A full recovery usually takes 6 to 12 months. By this point, you'll be much stronger in your day-to-day and feeling confident around returning to sports and any other more active things that you might have been struggling with before your operation. Many people at this point are pain-free, and certainly a lot of patients forget having had an operation on their hip. Remember, patience is key. Everyone's journey is unique, and it all depends on how strong and active you were before surgery and many other factors around your health and lifestyle. As you gain more strength, mobility, and confidence in your new hip, you will be able to increase your physical activity. You should discuss returning to specific sports, such as skiing, with your consultant at the 6-week follow-up. In addition to low-impact exercise, you should put lots of focus on following the exercise program set by your physiotherapist. People choose to get private hip replacement surgery for various reasons. For many people, it's the reassurance that they will be seen by a specialist without significant delay. Other benefits include the guarantee of consultant-led care from start to finish, the ability to choose the hospital and the surgeon that you want to have treatment with, and the guarantee of aftercare. I hope this brief run-through of a typical recovery from a total hip replacement has given you some insight in what you might expect from hip surgery and the recovery timeline following the procedure to getting you back on your feet. If you want to come and see me for a consultation to talk through your options for hip replacement or any other treatment options for your hip pain, you can find contact details in the description below. Alternatively, search for your nearest Circle Health Group hospital and the next available consultant in your area on circlehealthgroup.co.uk. If you have any questions on anything I've covered in this video, please comment below, as we'd like to hear from you. Otherwise, thanks for watching.